All right, in this video, I want to answer the question I've been getting a lot lately. As a physical therapist, can I just do remote therapeutic monitoring on my own? Do I really need to work with a third-party company to do this? And the answer is, yeah, absolutely you can do it on your own, but there's a lot of stuff to think about, a lot of rules and regulations, a lot of requirements to actually build these codes to then gain the benefits, right, of the additional revenue and increasing your patient outcomes. My name is Dr. Andrew Gorecki. I'm the owner of Superior Physical Therapy, as well as Movement-RX, the world's best remote therapeutic monitoring system that's out there. So let me tell you what I would think about if I was going to do this on my own. The first thing I would think about is, okay, so what are the codes and the rules that are attached to these codes, right? So the first thing we have to think about is we have to have a device, right? There has to be a device. It's not just about monitoring the patient. There has to be a device that the person has, in this case, where the home exercise program that you've created lives. And that device has to transmit information back and forth to you and the patient, right? So without a device, you can't do it. And so that's the first thing to think about is like, what device are you going to use? Do you have your own device? Does it transmit data back and forth? So that first code is all about setting up the device with the person, teaching them how to use it. And again, that's a one-time build code. Now, the second code is, again, about the device. This is the device that is monitoring the person's musculoskeletal status. And the rules about that code are that this is billed every 30 days, but you can't do the billing until there's 16 days of data collection. So you're going to have to track, like, does the person have the device? Did you set it up? And then is there data transmission back and forth for 16 days or more in that 30-day period of time, right? So that's an important thing to think about. Now, a lot of therapists are thinking about just the monitoring codes. Well, I can just monitor the patient and I'll just keep track of it in an Excel spreadsheet. Well, yeah, you could, but we have to make sure that everything that we're doing when we're monitoring is recorded. So the exact times, what was monitored, and there has to be a phone call or a video conference that occurs once a month. Excuse me. And so we think about the device. We have to track what we're doing during that time, what was monitored, what was said during the conversations. And then our device has to talk back and forth. So most people don't just have their own device that is going to, meet these rules and regulations. And then Movement-RX populates these codes automatically based on the activity that's happening, time. It's all set up to automate so that you don't have to think about the billing rules. You're just giving the person the app, making the home exercise program, and then our remote providers are doing the monitoring and the contacts and the minute thresholds. And the system is generating the codes for you, and then we just simply give you the codes to bill, right? So you didn't pay anybody in your office, and you get to keep 50% of that as profit, right? We keep 50% of that as revenue, and then we have to pay people to do the services of remote monitoring. We have to pay the developers to keep the system, healthy and making sure the data is being collected properly. So yes, you could absolutely do it yourself, but I can tell you that if you're like me, as a business owner, there's a lot of other things to think about. It's already hard enough, and most clinic owners, so you would be getting a 50% profit margin on these codes. Are you getting a 50% profit margin on the codes you're billing in your clinic? Most likely you're not. The average PT clinic is a 4% margin. So how you're already managing your team at a 4% margin, and you can get a 50% margin just by having someone else do this. That sounds like a pretty good deal to me. So anyways, hopefully this video helps.